We're going to start the panel discussion, and this is how we're going to spend the rest of our time together today. And then, do we have any? I have one question to get us started with, and I'll just, anyone who knows the answer to this question, go ahead and raise your hand and go forward. What is the omega-3 level in seeds and oils? Are there any benefits with omega-3 with medical cannabis?
So that would really be more hemp seeds. Hemp seeds are a perfect source of omega-3 to omega-6 oils. So, you know, sprinkling some on your yogurt in the morning, on your salads, that is an excellent source. The ratios of omega-3 to omega-6 in the hemp seeds are the perfect ratios.
And where do we get hemp seed?
You can get them pretty much at any health food market. You can get them at Sam's. I've gotten them at Sam's. I've gotten them at Whole Foods.
All right, here's a question for someone here. Any research been done on the use of medical cannabis for erectile dysfunction in men? I figured I'd just get that one out of the way.
I'll go ahead. Why did I say it? Go ahead. So there hasn't been a lot of studies published here in the U.S., which is one of the main problems that we have to deal with, is that the studies that have been done are done in Israel. There's about 40 years, a good 40 years worth of studies that are been published over there, but are not recognized over here. So I'm sure if you checked a website like PubMed, Trulieve also operates a website called Dr. Trulieve. If you do want to just leave your information, I can get you a login for Dr. Trulieve, where you can find U.S. studies that have been published in relation to medical cannabis and a lot of other issues. I have read that there are a few strains of the African land race, usually typically sativas, that can help with erectile dysfunction.
All right, very good.
Anecdotally, I've heard, is this on? So anecdotally, I've heard that cannabis-infused coconut oil applied topically can be very beneficial to both men and women.
Very good. Would it be better to use other forms of cannabis than smoking it because of a potential for lung cancer?
I don't want to answer all of them, but I am going to answer this one. So Dr. Donald Tashkin is a pulmonologist out of UCLA, and he did a research study. He actually set out to document the harms on the lungs. And he did a research study where he had 3 groups. He had cannabis smokers, he had cigarette smokers, and he had cannabis and cigarette smokers. So he figured that the cannabis and cigarette smokers would have the highest rate of cancer and pulmonary disease, that the tobacco smokers would have the second, and that basically he was trying to figure out what would happen. But he set out to prove the harms, and what he found was the highest rate of cancer and pulmonary disease in smoked cannabis was the study, was for the tobacco smokers. The tobacco smokers with cannabis were second, but not as high as the tobacco smokers alone. And then the cannabis smokers, their rate was equivalent to the general population. And so his conclusions were that even though it doesn't make sense, there appears to be something protective in the cannabis on the lungs.
Do we know if there are any clinical studies that are taking place in our region, Sarasota, Manatee County, or anywhere in this part of Florida?
I don't know of any per se that are in this region. I know there is it'll come to me when I'm not speaking in front of a bunch of people. There's multiple studies going on in Florida for cannabis testing. So it would be, say, like paid studies via a research group. You might have to go into Orlando or Tampa to do so, but I know they are available. I've participated in one.
Can getting chronic pain under control with medical cannabis products actually help to heal the body, or are we just hiding the pain? What's going on here?
I think it's a combination of both. So THC and CBD are known to be very potent anti-inflammatories. So as far as treating certain types of neuropathic pain and joint pain that have inflammatory components to it, I think that there's a real benefit to it in actually, targeting the pain. By the same token, I think that the THC, we'll get a lot of patients who describe, well, I don't know if it's actually getting rid of my pain, but I feel more relaxed and the pain doesn't bother me quite as much. So I'm able to sleep, and when you're able to sleep, it certainly helps with your chronic pain, and it just helps with everything. So I think, to answer your question, I think it affects it positively in both ways.
And this whole issue of inflammation, I mean, it seems to me the more I read, that a lot of issues that we have with our body's health are inflammation here and inflammation there. So I've heard a lot today actually about inflammation. If somebody would like to talk about how that's part of this entourage effect, or maybe I'm using that word incorrectly, but go right ahead.
So really, the root cause of the majority of diseases and conditions that people suffer from can be traced back to inflammation. So if we understand what Dr. Russo talks about, the clinical endocannabinoid deficiency, and we're supplementing and we're bringing the body back into balance, then that's getting rid of the inflammation, and that also speaks back to your chronic pain. Because if you can reduce the inflammation is what is the problem in arthritis, right? So if we can reduce the inflammation, then we're going to see the consequences of other symptoms ameliorating as well.
Ameliorating means going away.
Getting better.
Yeah. All right, so well, is my medical insurance going to cover some of the cost of these products out here?
No.
So is the pharmaceutical industry blocking this, or what's going on?
I will speak to this because I walk those halls in Tallahassee, and I have for the past 7 years. Our biggest opponents are pharmaceutical companies. This always gets me in trouble, but I'm going to say it anyways.
It's not like we're tape recording this.
Pharmaceutical companies, drug treatment facilities, and law enforcement are the biggest opposition to safe and legal access for people up at the legislature.
Are y'all aware of anyone who maybe is innovative in the insurance trade where they might start some form of insurance that would cover this type of thing? Anybody thinking or talking?
I think part of the issue is the fact that it's still a Schedule I drug federally. So Medicare, Medicaid, federally subsidized health insurance is there's no way that they're going to cover it at this point, and private insurance companies basically follow suit. So I think that's another thing, another important obstacle that patients are facing as far as having any hope that insurance is going to help out with this.
If I could add a point to that, just building on what you're saying, essentially it is the issue of the product being illegal at the federal level. So if we look to our northern neighbors in Canada, Sun Life Insurance is one of the first companies to cover medical cannabis for patients within the country, now that it is federally legal. And one of the largest employers within the country of Canada, Loblaw, who owns Shoppers Drug Mart, one of the main pharmaceutical chain that is dispensing medical cannabis in the country, is now covering it across all of their employers. So I think we can look again to our northern neighbors to see where the path is going. It is still federally illegal here, therefore it is unlikely to ever be covered from a medical payer standpoint, but once that shifts, we'll see the same dynamic changes they have in Canada.
So there are many claims being made for CBD. Are there any peer-reviewed, double-blind, or other legitimate research studies to which you can point us that reflect on the success of the CBD?
Yes, so there are some studies that have been done. The University of Michigan currently grows cannabis for the government for research purposes. May it not be the best cannabis out there, they do grow it. And there are some researches being done. If you do remember from earlier, the federal government does currently still hold a patent for cannabinoid care. So if you do, again, if you go to drtrueleaf.com, just enter in, a login information. I'm actually the one that provides access to that, and I would be able to let you in to see the studies that have been published here in the U.S.
Anybody else want to add to that? Okay. Why would a sense of well-being be a side effect rather than a primary therapeutic outcome? Is that just the way?
I have a friend who says that cannabis is such an excellent medicine, some people use it exclusively for the side effects.
Well said.
Nanotechnology, how do you move beyond the peaking and create more of a slow release to stay on a continuous elevated level so that the pain level is maintained and kind of controlled over a broader span of time?
So that can be handled with microdosing. Some places of employment, you only get a break at these certain times during your day, so you really have to medicate on when you are able to medicate, whether it's work or some other responsibilities that you have. Being able to, say, utilize capsules and vaporization in tandem is a great way to keep a nice steady level. Also, like say myself personally, I take 22 milligrams of CBD twice a day, knowing that it's going to maintain in my body for about 6 hours, and then I'll get another 6 hours around bedtime, which will help me sleep. And then THC I use in tandem, again, like I said, for neuropathy pain, and it will be a slow dose. If I take it in a capsule form, I can microdose at 2 milligrams per capsule and just take a capsule every 4 hours. And it's very easy to maintain just the right level instead of riding a roller coaster. That is not that's not the idea, is to ride the roller coaster. The idea behind nanotechnology is to enable an oral dose to be taken and delivered faster. If you use, say, a standard tincture, it could take up to 2 hours to take full effect. That is a very slow onset. So if that is the way you would like it, not a problem. Please do it that way.
So Dee, one of the things we've talked about in the prior forum as well as this one is this need to kind of take more responsibility for your own personal health care. So when you had talked earlier, and I think some of the others as well, about keeping a journal. In other words, this isn't just, hey doc, what do I need to do? This is a lot about what's working for me personally. And so I don't know that we can neglect that. Yeah, you can go get your medical card and you can go get your stuff at the little dispensary, but somebody should be giving everybody a journal at some point that they can keep track of this so that they can actually do better for themselves. Do y'all want to comment on that, or are y'all just trying to think who could get the journal printed faster to distribute?
We already have one.
Okay.
Yeah, there are some beautiful journals out there already. But I think the thing, especially with Western medicine, that has many of the healthcare professionals a little concerned is cannabis is an extremely empowering substance. It allows people to take control of their health care. This is not the way Western medicine is set up. What we are set up to do, for the most part, is to go talk to the expert, and the expert tells us very specifically what we need to do. This really puts the patient in the driver's seat. Self-titration, that's why mindful administration and excellence in education, it goes much more than just going and getting your card. You know, what is going to work for me isn't going to work for Holly. The route that works for me may not work for Holly. So the thing that's really important, and the reason why patients want a variety of routes of administration, you know, sometimes my husband who's got degenerative disc disease, sometimes we need to apply a topical. Sometimes he needs to dab high THC because THC is a powerful analgesic. And he doesn't use any other medication besides cannabis. It is the only thing that can touch his pain. So I think we need to really undergo a mind shift of what is health and what is well-being. And if we expect to go into a physician's office and be given something, and that's going to change everything without us focusing on what we put in our mouths. You know, what are we consuming? And consuming goes beyond what are we eating. What are we listening to? What are we watching? You know, are these things shooting up our stress levels? Because stress is #1 killer in the United States of America. So I guess I have a little bit more of a liberal perspective. You know, if people can use cannabis and they can have a little euphoria, I mean, a dying person, a chronically, critically debilitated person, an elder, a child, you know what? If they take something and they laugh and they get the munchies, I'm okay with it.
So this stuff's all great, but what's it going to cost me? What are we looking at, like, per month to get, like, an average treatment, which I know you're going to say there's no average treatment, everybody's different, but we got to put some brackets around this at least. We got to let people know what's this going to cost them. The insurance is going to pay, what's out of pocket.
Okay, so this is the #1 question. Everyone wants to know what it costs. I can tell you that there are products that are out there that are $20, $25. There are also products that are out there that are $120. For me personally, like I said, my cannabis tolerance is thankfully low. That's the way my body is built. I use probably about 20 milligrams in an entire day. I don't need to dab to get my pain down. I know many people that do. I know people that are older than all of you sitting down here that need more cannabis in an hour than I would put in my body in 3 days. That's all I can say is that it is very, very wide. If you use cannabis correctly, it shouldn't be something that puts you out of budget.
Yeah, but I want to hear a number. I got to hear a number. I got to bracket this thing. I got to hear a number.
So we do ask this question of our survey panel of cannabis patients and consumers across the United States. And across those medical and adult use markets, the average spend annually is $2,200 a year. Now, let's take the $2,200 and think about the variation by markets. So in Illinois, where about an eighth, about 3.5 grams of cannabis is priced between like around $65 or $70. you can be looking at, you know, $500 for an ounce of product, strictly flower I'm speaking of right now, versus another market such as Michigan, as an example, in which cost could be as low as $1,200 a year. The differential and the disparity in cost is due to the market structure that our regulators set up, essentially. So Illinois, a highly regulated, straight up, very high cost of doing business, contrasted with the Michigan market, which is essentially a caregiver structure, and therefore has a much lower cost of entry. Now, obviously, that is changing as they move to an adult use market. But again, average $2,200 a year, and there's significant variance across markets.
But that's the product. What about the state fee and the 6-month fee to go to the doctor?
That's
every
additional.
6 months. So, are you including that in that?
So for the product in Florida, what I have people telling me is that it's costing them anywhere between $250 to $450 a month for just the product, which is $2,500 a year to $4,000 a year, so it's kind of in alignment. Doctors are charging anywhere between $150 to $300 for a visit. It costs $75 to get a patient card through the DOH. It costs $75 to apply for a caregiver card. At 7 months, every 210 days, a patient needs to be recertified by another face-to-face visit. So these are some of the things that I wish people would reach out to their legislators, because those are all arbitrary and capricious numbers, okay? The reason that the patient card is only valid for a year is because the Director of Medical Cannabis decided that it was going to be valid for a year. So we've met with the OMMU, Florida Cannabis Action Network, is a patient advocacy voice, and we've said, hey, can we make these things in alignment? Like, can a patient card be valid for 5 years? Because driver's licenses are certainly valid for longer than a year. You know, can we make the timelines consistent? If we're going to have the card valid for a year, could the recertification visit also happen at a year? Because no notifications come out when you have to recertify your card. You just have to remember, it's time to go get another card. And it is, you know, part of this is very onerous on patients. It's a lot to keep track of, and we're talking about sick people, and we're talking about elders, and we're talking about moms and dads who have so much on their plate. You know, can we make this, can we remove some of these barriers? Can we prioritize ease of access? Can we put patients over profits? These are the things that our lawmakers need to hear, not just from me, but from everybody.
So Josephine, I'm just going to take umbrage a little bit with what you're saying, because I have clients that would benefit from being seen every month.
Sure.
And that's not about profit.
And that's,
it's about safety.
but it shouldn't be mandated.
No, but you're saying it should be mandated, right? It should be, hey, if you're going to say 7 months, you should say a year. But that's wrong.
As a mandate.
But that's wrong.
But for patients who need more, actually, I think that really who needs to step into this equation is case managers. Because the docs shouldn't be seeing the patients every month. But I believe in the education. And why don't we put the coordinators of care, the people who already do this for all of these other medical conditions, why don't we add them to the equation?
Because then you're putting, again, more profit in the head, right? Because it's still stuff to pay for patients. So, you know, you can't say one or the other. I think that there's some legislation because there has to be a way to keep people safe. It's not about making
Absolutely.
money always. It is a point of, there has to be some point where you do a check-in.
Absolutely. I totally agree with that.
So
And I think that a year check-in is 7 months isn't going to make a difference to a year. Or make the card the same amount of time. What I'm saying is all of these different dates that people need to keep track of are very confusing.
Why do you apply for health insurance on a yearly basis?
I don't understand your point.
It's the same thing, right? You're applying for health insurance on a yearly basis. Why isn't it every 5 years or every 10?
Okay,
John,
so
I don't understand what you're trying to say.
that's okay, but as moderator, here's what I'm going to say.
Yeah.
I think that we're probably not that far off. If I go to my normal physician and I have something, he's going to tell me, he or she is going to tell me, hey, I want to see you back at a particular interval. And I respect that because that's what they're doing. So I think we still have that opportunity now within this realm to do that. And so it's not a mandate for short-term or long-term, but it's more like that, again, that patient-physician relationship and doing the right thing for each person. So there's not a one-size-fits-all, but I think obviously there's a lot of bureaucracy that's been created to manage this. And I want to come back to one other thing too, just in full disclosure. We invited, when I say we, it's the royal we, it means somebody else besides me. The Downtown Sarasota Condo Association invited all of the members of the legislative delegation that represents this area. We have a representative from Margaret Good's office here, and so we don't like to lose these opportunities to have these scientific conversations without inviting our legislative delegation, our elected officials. They were all invited to come and join us today. We have one representative here, so I think that says something about what's going to happen and what's going to change, and that's from Margaret Good's office. So we appreciate you being here. That is what it's going to take, folks. And I think if we had, everybody's busy, and if more members of the delegation were here and got to hear what we heard this morning and what we're talking about right now, that's what's going to make the change we're looking for. Okay, here's one that'll get us right back into this conversation. Since Florida licensed the medical marijuana treatment centers, they can talk with patients and help them get the product. But as this person understands, they're not actually treating the patient. Where can medical cannabis patients go to get help in actually using and treating with their medical cannabis products?
So there is a gap. Okay, so you go see your physician gets you that recommendation, and then you're off to the races. You head to the dispensary and you are tasked with how much do I need? Indica hybrid sativa, topical vape oral, strain differential, ratios, lots of things you need to take into consideration, and every single one of those decisions is crucial to your care. It is something that every MMTC is trained to help with, but again, we are not your body. Even your physician, it does not know your body like you will know your body with cannabis. There is a new kind of niche market for cannabis nurses that is arising. They are usually RNs that have a passion for holistic medicine, and they will take a role and try and help you out with your journaling, and they will ask you the questions that you don't remember to ask yourself. They'll ask you, how did you feel? How long did it last? Were you tired, sleepy, happy, or hungry? And what's your pain level, 1 through 10? Those questions are what you need to be asking yourself every time you administer to figure out your correct dosages. So these cannabis nurses, we're calling all people, all nurses, to kind of step into these roles, work with the physician's offices, caseworkers to do the same thing, check in on people, see if they are using too much or abusing their medications. And social workers to also help out the elderly and the young.
So here's another question that kind of begs to a little bit more of the bureaucracy. As a professional guardian and an avid hunter with a concealed weapons permit, when is the law going to change for the caregiver card so that I'm not punished personally for what I do professionally?
Going to Tallahassee and complaining about it. That's the only real way you can do that. The law is the law, that's the way it was written. I just had this conversation with Tom, my associate, who manages a gun shop here locally. Same deal as the law, and just letting your local legislators know that that's an issue and it needs to be addressed.
So what's the issue? I can't have a concealed carry and a card, or what?
No, if you have a concealed, you have to actually sign a waiver stating that you're not under any kind of influence of any kind of medication or anything that may impair your judgment with your firearm.
Sure.
Can I say something?
There is a workaround. If you, and I'm not an attorney, if you apply for your medical card after you get your concealed carry weapon, you can have both of them. There's nothing in the law that says you have to let anybody know that you are a medical cannabis patient. So that is one thing, and I know that Commissioner Freed has been very outspoken in saying that you can have both of them.
Okay, so I think I know the answer to the question, but I'd like to ask all the questions so no one feels like I hid their 3x5 card. But are there any state or federal bills to allow assisted living facilities and such to dispense and monitor marijuana as they can do for pain meds now? Okay, so everybody's shaking their head no, but...
No. There is no answer to that. No, there isn't.
Where can we get a link for the Tecum Olam research? Is that something, Patrick, that we could put up on the Downtown Sarasota Condo Association website, which is a great time for me to say that it won't take long. We'll have every slide program, we'll have the video, and we'll have some other linkages there for you, and you can go back on the website and actually watch all the presentations for all the other forums that we posted and see all the slideshows. But there are some specific things that folks have talked about today. And then, how does medical cannabis affect blood sugar levels?
With blood sugar levels, it's a very hard science to tackle. It's really about finding the correct strain. It can also affect blood pressure. I know with myself, I have to monitor my blood pressure daily, and I have noticed that indicas tend to lower my blood pressure, sativas tend to raise it. As for blood sugar, I don't have as much experience with it, but utilizing these THCV and Hubeline strains will enable you to lower your blood sugar by not eating as much. It is not a direct, it's not a direct change in medication, like i.e. stop taking your insulin and go ahead and use medical cannabis, but it is something you can use in tandem with to possibly reduce the amount of insulin you're going to use, or hopefully not have to.
Does RSO really cure or shrink brain tumors? My niece has a GR2 oligodendroglioma, which was partially debulked. How would medical cannabis help her? Because she has residual seizures from that.
So RSO is Rick Simpson oil. My preference is to call it FICO, full extract cannabis oil, because Rick Simpson oil is kind of a trade name or something. But there is evidence that, mostly anecdotally, but there is research that's being done out of Competencia University in Madrid. Dr. Cristina Sanchez and Dr. Manuel Guzman are working in collaboration with Mara Gordon, who I mentioned earlier. So Cristina Sanchez and Manuel Guzman have done preclinical and animal studies showing effectiveness on what we call apoptosis, the programmed cell death of a cancer cell. So what happens in cancer cells is they proliferate out of control. Like usually a cell has a life, a start and an end. What happens in cancer is it just keeps going and going and going and spreading and going and spreading. And so we are starting to see some anecdotal evidence of cannabis promoting apoptosis, stopping cancer cell tumor growth, and in certain instances even reversing it. It's very, very preliminary. And beyond that, GW Pharmaceuticals has orphan drug classification through the FDA for using cannabinoids in the treatment of glioblastoma, which is a brain cancer. So there are even some FDA studies coming out of GW Pharmaceuticals, which is a patented plant-based cannabinoid showing. Now, unfortunately, there's not really, we haven't progressed to the point where doctors are skilled necessarily at treating the cancers. It's a lot of trial right now. For the most part, our hands have been tied in conducting these kinds of studies in the United States because of the federal one scheduling. And so I'm really hoping that that is something that we can start moving towards beyond symptom control, but actually disease management, especially in cancer, and maybe even in Alzheimer's disease. Because there's some pretty impressive preclinical research coming out of Roskamp University talking about how cannabinoids can actually help remove the amyloid beta from the brain. And the amyloid beta is what sticks together and forms into the plaques and tangles that kind of get stuck in the brain.
So what about ADHD? What can medical cannabis do about those of us that suffer from that?
Again, I've seen a number of patients who have come in with symptoms of ADHD, and they've been on stimulants, Adderall, Concerta, and they didn't like the side effects. They didn't feel that it was helping them to the point that it was worth dealing with the side effects, and they've come to me after they've self-medicated with marijuana, and they say that it's the only thing that really helps them. And specifically sativa strains, which are known to be more stimulating and more in line with most of the stimulants that pharmaceutical companies are selling to help these patients. So I can't cite any research specifically. I can tell you anecdotally that the patients that we've seen have done very well with the sativa strains of cannabis. And that's kind of how I see it.
So if someone came into your office tomorrow, for instance, with an appointment, and this is what their symptom was, then you could advise them and say, this is kind of the strain you're looking for, and when you go down to the dispensary, this is kind of what you want to be looking at.
That's what I would discuss with them if they had a diagnosis of ADHD, and I came to the conclusion that it seemed to be consistent with that diagnosis.
Now what about depression?
I just want to throw in that we do have a little bit of research here in Florida. When the law was passed in 2014, the University of Florida was given grant money to conduct cannabinoid research. And the study that they decided to do was on children with autism, which showed a great improvement in, I don't remember, 25%, I think, of the patients. But the secondary benefit that they saw was that some of the patients with autism also were diagnosed with ADHD, and they saw an improvement in the ADHD symptomology, even though it was an autism study.
So we know that ADHD is rising, we know autism is rising. These are upward trends in our nation and perhaps elsewhere on the planet, so that's kind of cool. Now, what about mental health in general? I mean, we got a lot of more awareness of mental health issues in our community, and certainly depression is one of those. But are you aware of other mental health symptoms that are being treated with medical cannabis and what's coming out of that?
Post-traumatic stress disorder, all kinds of anxiety-related disorders, panic attacks, depression. It can be incredibly therapeutic with mental health. And again, like I spoke in my talk, cannabis is an excellent adjunct to many behavioral health interventions. Meditation, guided imagery, yoga, it increases the range of motion, mindfulness. So the way cannabis works also, besides tackling the symptom, is it helps shift a perspective where you're better able to cope with your problems. You may still have the same issues, but you can cope with them a little bit better. And if you can cope with your challenges better, it's going to increase your quality of life. So, you know, my background is hospice medical social work. Everything is about increasing quality of life. But not only for dying people, for all of us. We all need to increase our quality of life.
And quality of life is translated by Downtown Sarasota Condo Association into optimal living. So this is for all ages, this is for all of us. This is an opportunity for all of us to learn more about what we're going to put in our body that's going to help us cope with everything that's being put in our body now. Nikki Kobritz, who was with us here for a little bit, she's been a speaker here twice before on brain issues. She runs the Center for Brain Health, talks about air pollution, water pollution, the toxins in our food. Everything that we're consuming is eroding our bodies. And so this aspect of the inflammation, which comes from those things being treated here. But I think one of the most important questions I've saved for last, and this is, please have Josephine tell us about her shoes.
They were a gift from a friend, and I'm incredibly honored that she saw these and thought that I needed to have them. And I would like to just end by saying, you know, there's even studies that were done in Jamaica on pregnant and nursing moms, Rastafarians who used cannabis regularly, and they showed great benefit to the child's development. You know, much of what we have been taught for the past 80 to 100 years is prohibitionist propaganda, misinformation, and flat-out lies. Cannabis can be used from the womb to the tomb. Quite honestly, it just can. For everybody? No, nothing is for everybody. Will it replace all pharmaceuticals? No. It's another tool in the toolbox.
I thought I was out of questions, but I've got two more, and then we're going to do something a little different than we've never done before. But what about cannabis and rehab for other addictions? People are addicted to other drugs. What's cannabis? What's the role there?
So Julie,
fighting over the microphone.
Julie personally has been able to touch base with quite a few rehab clinics, and there's been an amazing benefit to using cannabis in conjunction with whether it's methadone or Suboxone, and cutting the time down drastically in rehab. And then it sticks much better if the patient is allowed to self-medicate on a schedule. So there's definitely great promise in using cannabis and hopefully getting some of those harsher medications out of the way completely to get people clean and healthy.
Anybody else want to comment on briefly?
I'll briefly, so I'll just say that cannabis is not a gateway drug. Cannabis is the exit ramp off of addiction.
One of the obstacles that we face, practical obstacles, is we have a large number of patients who have been on high-dose narcotics for chronic pain syndromes for a long time, been on benzos for a long time, and whether they're actually working to help patients with their symptoms and their pain, we can't even say conclusively that it is anymore, but they're basically addicted to them because they've been on them for such a long time. Pain doctors make patients sign contracts that they won't get medications or scheduled medications anywhere else. And when patients express a desire to find out about getting a cannabis card to help with their pain or to try to come off, they're actually told that they're going to be thrown out of the pain practice and they're not going to get their medications that they're addicted to anymore. They'll be cut off. So patients now have to make a decision, well, I want to try this, but I can't come off the other stuff without tapering off slowly, and I'm caught in limbo. So, you know, that's turned out to be a big obstacle for us. The docs that do go along with it, and we work in unison and together and try to get patients off the other medications. What I'm finding is that the ketamine certainly quells a lot of the withdrawal symptoms. There's no doubt about it. And so patients are able to, just clinically I can see it, come off medications, come off the Dilaudid, the fentanyl patches quicker while they're medicating with the cannabis. And I think there's definitely a role for that, for sure.
All right, and then just to be sure, because this is all new stuff and we don't want to go headstrong into it, but can you address the contraindications of CBD and THC?
So there's a really beautiful down and dirty test for CBD. It's called the grapefruit test. I don't know if any of you have had this. It's commonly talked about with other medications by doctors, and patients will sometimes be told, if you are using this medicine, you can't take it with grapefruit because of the interaction. CBD is one of those compounds. So if you're on a medication that can't, or you should be mindful of taking with grapefruit, then you need to be mindful when you're taking CBD as well. Doesn't mean that they can't be used together, but it does mean that you really need to look into it a little more clearly. And there's an excellent website, www.projectcbd, and you can look up, they have like a conditions list, and you can look up by condition, and then they have listed out different research studies and articles, and they do a really nice write-up on CBD.
Okay, so we're going to give away a few more prizes in a moment.
Oh, and cannabis, medical cannabis, is contraindicated with warfarin or Coumadin.
Pregnancy. I would avoid THC, patients who are pregnant as well.
Although I think you also, it's prohibited by law, but we regularly prescribe SSRIs for pregnant women for anxiety and depression, and we know that those can cause birth defects. So before we just say pregnant women shouldn't use cannabis, high THC, I think we need to start looking at the Jamaican studies, and we need to start looking at some of the harms of the other medications that we regularly prescribe to pregnant women, and we need to consider if perhaps we need to do things differently.
Okay,
and I'm not a doctor.
Everybody good? All right, so do something we've never done before. Starting down there with you, D. One sentence or one statement to wrap up what you need to share with this group today. One sentence or one statement. That's it. I'm going to cut you off.
Okay, all I'm going to do is say, this is my favorite quote when speaking about medical cannabis. Chasing high THC cannabis can sometimes be like choosing to drink Everclear over Cavassier.
I hope that we as a society are moving in a direction to keep an open mind as to alternative treatments for a lot of common conditions patients are struggling with, and cannabis is certainly one of those things that can be very beneficial.
I'd say speaking with other people in your neighborhood, your friends and people you go to church with, about cannabis, and also contacting your local representatives in Tallahassee, because that's where the change comes from.
As I said in my close, it's not about getting high, it is about getting well.
Oh my, one thing to say.
Just one, or I'll read my bed.
I think that it's really time that we step out of the shadows and into the light. Cannabis has been used therapeutically for thousands of years. It's been used regularly by Americans for a very long time for symptom control. And it's time to break open those stigmas and bust through those stereotypes, because we've had people share today that they're medical cannabis patients, and I don't think that they're lazy stoners, whatever that means, because I don't even know what it means.
Holly Bell, bring it home for us.
Okay, mine is an ad similar to Rick's, and that is an adage I try to live by and pay it forward. If you've learned something today, if you've benefited, if you've enjoyed it, if you think this could help somebody you meet in the future, please share. Because that's how we're going to spread the good word. One of us goes out and shares it with another, and they'll share it, and it's just helping one person at a time, which makes the earth a better place.
All right, folks, let's hear it for this group speaking truth to power.